All right, I'm going to go explain what a PAWP means. Okay, you've probably seen this and you're like, what does that little acronym mean? It means pulmonary artery wedge pressure. So that little balloon you see right there is inflated and it will wedge into the pulmonary artery. So that's where you get the pulmonary artery wedge. And so I'm going to show you in this diagram what and how the PA catheter, also known as the Swan-Ganz catheter, can float down into your heart and wedges into the pulmonary artery. So what happens is the provider will float a PA catheter down into the right atrium first, and that's also known as your CVP. And so that has a specific pressure, so you can measure your central venous pressure. Then it flows down to the right ventricle, and then it goes up through the pulmonary valve into the pulmonary artery. And when you inflate the balloon, it wedges into the pulmonary artery, kind of taking a snapshot picture of the left atrium, the left atrial pressures, because you can't really get over there on the left side. And you can notice what your filling pressures and your left atrial pressures are. Now, a lot of times we don't wedge it and we just take the PAS and PAD, which is the pressure of the pulmonary artery, and we take the PAD as a snapshot of what a wedge pressure would be. So a lot of providers don't like us to wedge the pressure. So this PA catheter will give us a lot of hemodynamics. It's really important to know that 6 to 12 is a typical normal PA pressure. And I'm Professor Molly, and I hope that makes sense, and follow me for more nursing tips.